Now we're on to chapter 15. This is the nervous system, and it also really lumps in all of the behavioral health terms, so the psychological disorders as well. I'm guessing because nervous system kind of includes the mind, so it's the natural place for it. This is the last chapter in Unit 2. If you felt like there weren't enough words already, we're going to get a whole new chapter's worth. So here we go. When you're thinking about what is the function of the nervous system, it's basically a communication system. So it's going to communicate from your brain and spinal cord to the rest of your body to try to coordinate functions and activities, whether it's you trying to move your body by stimulating the muscles or you telling your organs to do different things. It's also kind of a monitoring system. So it's going to detect changes inside your body and outside your body. If you've learned about sensory stimuli, for example, we take in information from around us and kind of send signals back and forth to respond. It's one of those characteristics of living things. And then lastly, it also provides for the mental activities, which is why those psychological disorders are in this chapter. It helps thinking, memory, emotions, all of that is controlled by the nervous system. So first we're going to kind of learn the key parts, and then we're going to do the words that go with those key parts. The nervous system is broken down into different kind of subsystems. The main one is the central nervous system, or the CNS. So this includes the brain and the spinal cord. So here's kind of the generic picture in your book of the brain from a side view, and then your spinal cord as it goes down. The peripheral nervous system is pretty much the rest of your nervous system that is not your brain and your spinal cord. It's all of those nerves that are running away from the spinal cord all the way down to the tips of your fingers and the tips of your toes. That's called the peripheral nervous system, or PNS. In this case, when you're looking at a zoomed in picture of the brain, there's a couple different parts. So one of them is called a ventricle. And this is just basically a big cavity inside your brain, but it's not hollow. It's filled with your cerebral spinal fluid. So these are really the spaces where all that cerebral spinal fluid is flowing around in your brain. There are two major parts, the cerebrum and the cerebellum. The cerebrum is that large top piece, and that one is kind of the one that's divided into two hemispheres and controls a lot of your muscles, sensory input, sight, hearing, memory, all of that is in the cerebrum. The back little piece, the little brain as it's sometimes called, the cerebellum, is also called the hindbrain. You might have heard it called that before, but it's really your coordination and balance. So people who have problems with that section of the brain really have a hard time maintaining proper balance. As we move under the brain, there's the brain stem, and there's a bunch of different parts within the brain stem. One of them is called the midbrain, and then there is the pons, and then there's the medulla oblongata. Those three sections together are considered the brainstem. So the midbrain is the topmost part, and then the pons literally translates to the word bridge, and it basically connects the cerebrum with the cerebellum and the brainstem. It's kind of that joining area. The medulla oblongata is really interesting because it connects the pons to the spinal cord, but that's really your key center for controlling respiration, heart rate, muscles in your blood vessels and that help you figure out your blood pressure. All of those things are in that little area. So that's why sometimes if you get a brainstem injury, you might not be able to recover even if the rest of your brain is okay, because that region right there is responsible for controlling the vital functions like your heart rate. All right, so this is a zoomed in picture of your spinal cord, and it also includes the layering that surrounds that, which are called the meninges. These are the membranous layers that cover your brain and spinal cord. There are a series of 3 layers. So there is the pia mater, which is the innermost lining. There is the arachnoid, which is in this picture the blue, which is the intermediate. there is a space underneath the blue called the subarachnoid space, and that's where cerebral spinal fluid also flows between the ventricles and your spinal cord area. And then the hard part, or the outermost, dura means hard, dura mater, is that extra protective outer layering. And if you've ever heard of meningitis, which is a common infectious disease, it would lead to inflammation of those particular membranes. I'm not going to ever require you to memorize these. Maybe you might need to in psych. There are 12 cranial nerves that you have in your body, and they all target and innervate different things. So you can kind of see where in the brain the nerve is, and then where that projection leads out to. So if you have some kind of brain injury, it might lead to problems with your eye if you're talking about the optic nerve, or it could be problems with your facial nerve. Let's say you have a small stroke and then that side of your face is drooping, or your cochlear nerve might lead to hearing problems. So each one of these kind of innervates a different area of the face and can lead to different problems. All right, so that was the body in a nutshell in terms of the nervous system. Now we can actually put some words with that. A lot of these are pretty much how they sound in terms of the anatomy. For example, cerebello is cerebellum, cerebro is the cerebrum. Cerebro is also used just more generically to mean brain. So if you wanted to talk about just the brain area itself, then you can use cerebro. We did learn a while ago that cephalo also means brain. You can kind of use those interchangeably. Duro means hard, like in dura mater, that outer layer of the meninges. Encephalo means brain also, so kind of within the brain is really where the end goes. Ganglio and gangliano both mean ganglion, and these are nerve cells or groups of nerve cells that are kind of laid periodically throughout your body. They're not in the central nervous system, but it's where groups of nerve cells kind of come together. Glio is for glia. Glia are not necessarily nerve cells like the traditional neuron that we've known about. They're specialized cells whose job is basically to aid, support, and nourish those nervous tissue cells. So that's kind of what their job is. They secrete cerebral spinal fluid. They can't actually transmit signals like neurons do, but they're the helper. Meningo and meningio are both standing for meninges. So you might see, for example, meningitis as one common term that's associated with this. Myelo is a tricky one. In this case, myelo means spinal cord, but please note that in chapter 14, which you just learned about, myelo also means bone marrow. So because they mean two completely different things, you need to rely on the context of what it is that you're reading to figure out if they're really talking about bone marrow or if they're talking about the spinal cord. And then lastly, we have radico, radiculo, and rhizo. All of those, oh, I skipped neuro, which means nerve, but these three mean nerve root. And if you look at the picture of the spinal cord once again, the nerve root is the part that's closest to the spinal cord. It's kind of those connecting pieces between the spinal nerves or the peripheral nerves as it connects to the spinal cord. So if you have a diagram, whether electronically or hard copy, I would say label these so that you have them to study. There are diagrams in your book too to label if you want to just use those on page 594. There's a couple more combining forms. These ones are commonly used with the nervous system but aren't anatomical in nature. So esthesio means feeling or sensation. So because we're talking about the nervous system, it has to do basically whether or not you can feel some kind of sensory input in various areas. Mento or psycho has to do with mind. So you think of mental disorders, or you would go to a psychologist. Those are all things that are related to the mind. Mono, I'm guessing you know, means one. Phaso means speech. So we're going to come into terms like aphasia, dysphagia, things like that, where speech is either disrupted or absent due to some kind of nervous system issue. Polio, not only a disease, but in this case, polio has to do with gray matter. Your brain has two kinds of matter, gray matter and white matter. So if there is some kind of injury with the gray matter portion, then you would see polio. And if you're ever interested in knowing more about that, you can kind of search it up. It has to do where the axons are, whether it's gray matter or white matter. And then quadri has to do with four. Most oftentimes I think of quadriplegia, for example, or a person who is a quadriplegic means that they can't use their four limbs. And we'll see that in this chapter too. So take a break, maybe try exercises 6 and 7. Just get these words down before you move on to creating full words. Which leads us to the suffixes. There's not a lot, and the first two have to do with the specialists. You can be an iatrist, like a psychiatrist. It just means a specialist or a physician. But we also learned a while ago that logist also means a specialist. So, for example, you can be a psychiatrist or a psychologist. Both of them mean specialist, and there are differences in what a psychiatrist could do versus what a psychologist can do. But when you're literally translating the word, they both mean specialist. Iatrist has to do more with the medical side or the medical physician, but we'll get into that later. Iatry would be the specialty. So whether you're studying psychiatry or psychology, for example, we also learned that logy means study or specialty of. Ictal is this one right here. It means seizure or attack. So oftentimes you might have seizures associated with the nervous system, and depending on when those attacks are, you're going to use ictal. And paresis. Paresis means a slight paralysis. So you're not paralyzed, you're just slightly going under paralysis, meaning that either you've temporarily lost sensation, but it's not permanent, or it's just less than normal. Maybe you just feel extremely hard pressure, but not the normal amount of pressure. If we remember back, or maybe you haven't learned it yet, I'm trying to think. The suffix plegia, P-L-E-G-I-A, means full paralysis. So depending on the condition, paresis would mean slight paralysis, and plegia would mean full paralysis. We'll see that more specifically later on. As I mentioned before, myelo is one of those tricky ones. In this chapter it means spinal cord, but in that last chapter it meant bone marrow. So just make sure you're looking for the context of what is being said to figure out which it is. And as I just mentioned, paresis versus plegia indicates really a level of severity in the injury that the person might have suffered. All right, so which one of these means slight paralysis? Definitely A. I'm guessing we can remember to the slide before us. We finally get to the part where we put the terms together. And these first ones are all from word parts. So that part is nice because then you can kind of use what you've learned throughout. Again, we jumped around in the book a bit, so there might be some pieces that you haven't explicitly learned. If that's the case, please make sure that if you're unsure of what a word part means, you flip to the appendix in the back. I believe it's Appendix C, but let me check really quick. Yep, starting on page 722, it goes through all those word parts and what chapter it came from. All right, so here's the first part of the list. We have cereballitis, which is pretty straightforward, inflammation of the cerebellum. Cerebral thrombosis. I'm not sure if we've learned thrombo. That has to do with a clot. So cerebral means pertaining to the cerebrum. And then thrombosis would be the abnormal condition of a clot. So what does that all mean? It means you have a blood clot in your cerebrum. Duritis, inflammation of the dura mater. And then you can see a lot of other itises depending on what is inflamed. You can even see this super long word here, encephalomyeloradiculitis. Whew, that's a long one, I realize that. So sometimes with these long ones it helps if you just chop it up where the different pieces are, so then you can kind of say them in parts. But what this really means is inflammation of the brain and the spinal cord and the nerve roots. So it's a lot of inflammation in various areas. We also have malacia in here as a suffix that we had seen previously. So in this case we have encephalomalacia, so a softening of the brain. We're going to be bringing back some cancer terms as well, as you can see. One of them, for example, is a glioblastoma. So we're talking about the glia, and then this would be a tumor of the developing glial cells, basically. A glioma would be a tumor of the glial cells, and you can have tumors in various areas. I think we might have not seen this suffix before, cele, C-E-L-E, just to make sure we're on the same page. Cele means a protrusion, so something is basically sticking out of where it should not. It's oftentimes associated with a hernia. If you know what a hernia is, sometimes it gets the cele word in its medical term. Meningeocele would be a protrusion of the meninges, which really means that these layers of the spinal cord are kind of sticking through the vertebrae. So sometimes your spinal cord can get bent a little bit and stick out through those vertebrae bones, and it can cause a lot of problems. You can also have a meningeomyelocele if the nerve roots are also sticking out. The generic word for nerve pain is neuralgia. You can see the O was removed because algia starts with an A. If you remember, algia means pain. So pain in the nerve is one common term that you might see. All right. If we're looking at the end of the list here, it's pretty similar to the other words that you've seen. I'm not going through every single one. Lots of different inflammations, lots of different diseases. Just to say this crazy long one, rhizomeningeomyelitis. So this would be inflammation of the nerve root, the meninges, and the spinal cord, so all these different areas. One that you might have heard a lot just in medical shows or whatever, subdural hematoma. So this means below the dura mater is what subdural means. And then literally, this means a tumor of the blood. But it's a little weird because it's not actually a tumor of the blood. It basically means that there's a pool of blood. So it's like a tumor in the sense that it's a little bit of a mass, but it's basically a giant pool of blood. So some kind of blood vessel has broken and the blood has pooled to an area, similar to how you would get a bruise, although more extreme. And so if this happens under the dura, you can get a subdural hematoma. There's a lot of words here, so please make sure you're going to take a break, work on exercise 12. It's on page 600 of your book, just to get these in practice before you have to go to the ones that are not built from word parts. All right, so this is an example of a picture where you can see in the middle that giant golf ball size white spot right here. tumor of developing glial cells. That would be the glioblastoma. Here's an example of what one of those meningiomyocele has to do with, where it's got the nerves kind of sticking out. You can see where the vertebral column is, and it's sticking out. You might have also heard this as spina bifida, which is another common term that you might have heard this by, or has a similar result of, I would say. And you can see how it's kind of sticking out here. This can be surgically repaired. Here's an example of what that subdural hematoma is. You can see below the dura mater, and then one of these blood vessels around here must have broken, so now we have this pool of blood. It can lead to a lot of pressure and problems. A blood clot, or a piece of atherosclerotic plaque, which we haven't learned yet, that lodges on a cerebral artery is called. So we have cerebral embolism or cerebral thrombosis. In our case, we haven't really learned what an embolism is, but we're going to learn that next. It's similar to a thrombosis in the sense that a thrombosis is a blood clot. If that clot then dislodges and moves to a new area, like this question is suggesting, then it becomes an embolism. So this really isn't a review question. It's a preview for the next list of words question. All right, so let's go through the not word parts. These ones are a little less fun because you have to straight up memorize them. So the first one is Alzheimer's disease, or AD. And the way that your book is just defining it is it's a class of dementia that really occurs in older individuals, and it has to do with certain nerve cells dying, and then it kind of progresses and gets worse, and it really affects the memory, is really one of the hallmarks of the disease. The next is ALS, or Lou Gehrig's disease. ALS stands for amyotrophic lateral sclerosis, big long mouthful, which is why we call it ALS. It basically means that the neurons that are communicating to the muscles are atrophying or wasting away. So it's not the muscles that are the problem, it's really the communication to the muscles that is the problem. And those neurons can get scarred also. So they kind of stop communicating between the spinal cord and the muscles. Bell's palsy is really a compression or a problem with the 7th cranial nerve. This is the one that innervates the face, and so what happens is that facial nerve is damaged or something happens and it can't prop up those muscles of the face, so you end up with one side of the face kind of drooping or sagging. A lot of times this is temporary and can be fixed. It also might be a result of a stroke, something like that, but that's what that is. Cerebral aneurysm is an aneurysm in the cerebrum, pretty straightforward. You usually don't know it's there, which is kind of crazy, until it ruptures, which this is a common cause of death. Oftentimes if you have an aneurysm, which is one of those kind of pocket of blood clots, if it bursts, then it can lead to massive blood loss and oftentimes death. An embolism, like I had mentioned on the last slide, is where you have a blood clot dislodge from its original location and kind of travel through the bloodstream and get trapped somewhere else. Oftentimes, atrial fibrillation or some kind of stroke might lead to the creation of one of these. Cerebral palsy, or CP, is lack of muscle control. So this is a brain problem that's oftentimes congenital, so you're born with it or it happens shortly after, and your brain is not effectively communicating to the muscles, so you end up with kind of partial paralysis, or inability to control your muscles. Dementia is a super general term. As I mentioned, Alzheimer's disease is one class of dementia. It's basically cognitive impairment, so you're losing brain function in some way, shape, or form. Whether it's learning, retaining new information, certain behaviors, that kind of thing. Epilepsy is where you have reoccurring seizures. So it's not a one and done, but it happens over a period of time. And it really is a result of electrical problems in the brain. So the electrical activity is abnormal in some way. You have misfirings or miscommunication, and it can lead to seizures. Hydrocephalus means water on the brain. It really has to do with your cerebral spinal fluid. And it gets either stuck in the ventricles, or the ventricles get dilated as a result of bad circulation of the cerebral spinal fluid, and it can cause all kinds of problems. An intercerebral hemorrhage is really when you are bleeding into your brain as a result of a blood vessel breaking. And depending on where your hemorrhage is, you can get different types of brain symptoms. Stroke is often a cause for this type of hemorrhage. Multiple sclerosis, or MS, is where you get these little patches along the brain and spinal cord, and it is a progressive degenerative disease that these patches then prevent communication from the brain to the muscles and other things, and therefore can result in balance and problems, numbness, vision problems, and so on. It kind of fluctuates, so it is degenerative, but it has good days and bad days, so to speak. Parkinson's disease is another degenerative disease. This affects a different area of the brain, or a different type of cells than Alzheimer's disease. These are the dopamine neurons, and it results in problems with balance and coordination. So they have trouble changing gait, meaning going from walking to running, and so on. It also results in characteristic hand and feet tremors, so you can kind of see that shaking. That's an indicator for Parkinson's disease. Sciatica has to do with your sciatic nerve. This is one of those nerves that runs down your leg. So if you have some kind of compression injury, infection, or hernia, or if you just sit for a really long period of time, sometimes you get that sharp shooting pain that runs down your leg. That could be sciatica. Shingles is a viral disease. It's kind of like chickenpox number 2. It's caused by the same virus, herpes zoster. But it's lumped in here because it affects the peripheral nerves and can also give you super bad skin blisters that can then affect your nerves. Stroke. The generic term stroke really just means that there's an interruption of blood supply. So you're cutting off blood to a region of the brain, which is a problem because that blood is carrying oxygen. So you can't deliver oxygen to that part of the brain. And there's different ways that this happens. If it's a blocked blood vessel, it could be called an ischemic stroke. If it is a brain bleed, it could be a hemorrhagic stroke, and so on. So there's different ways in which this happens, but the point is that you're cutting off blood supply. A subarachnoid hemorrhage literally just means that you're bleeding into the subarachnoid space. This is really a cause of having a hemorrhagic stroke. And lastly, we have a transient ischemic attack. This is a sudden deficient blood supply to the brain for a short time. That's what transient means. It's not permanent. It's just you're cutting off blood to the brain for a short time. And it can kind of be like a stroke, but if you intervene quick enough, then normally they can start up blood flow, get oxygen to the brain, and it's kind of the spot at which you can come back from getting a stroke, whereas if symptoms persist, it can lead to a stroke. All right, that was a crazy amount of terms. So I would say maybe work on exercise 15. It goes across a couple of pages. You can see some pictures of what some of these conditions are before you have to move on. As I mentioned, there's different kinds of dementia. It's a very general class of terms. Alzheimer's disease is the most common that we would think of, but there are different kinds. I'm not going to expect you to know all the different kinds, and that's fine. So in your book, there's a table on page 604 that kind of really goes through the different parts. You don't have to know them, but please read if you feel interested. Here's just a picture of what you can see from a normal brain to an Alzheimer's brain. You can see what happens to the grooves and folds as they begin to shrink thanks to the loss of nerve cells. Here's an example of Bell's palsy. So you can see the cranial nerve 7 on the person's left side of the face has been damaged in some way, so it's not able to stimulate the muscles, so you can't really open your eyelid. There's a lot of drooping. As I mentioned, there's different kinds of stroke. One is a result of bleeding. So that's the hemorrhagic version. So you can have a cerebral aneurysm, which is really a kind of, it's not necessarily a blood clot, but it's a little outgrowth in the vessel that when it explodes can lead to death because it results in a lot of bleeding. You can also have a ruptured blood vessel somewhere in the intracranial area. Ischemic stroke has to do usually with blockages where you're just cutting off oxygen. There's not a blood bleed. So you can have a cerebral thrombosis, which again is just a clot. It hasn't moved. This is where it originated. Or for some reason this thrombus dislodges and starts floating somewhere else and gets stuck. That would be an embolism. Sometimes if people have lung issues, you might have seen this on a medical show, they can have an embolism move from their lung, for example, to their brain. All right, here's a picture of what shingles looks like. Again, it makes little plaques on your nerves, but what we usually see are those skin rashes and blisters. It can be super painful, but that's really why it's lumped in the nerve category, because it affects the nerves as well. So to review, a general term given to a group of neurologic disorders by having abnormal electrical activity is called, when you think about electrical activity, hopefully you are thinking of epilepsy. Bell palsy would be really the cranial nerve problem that we spoke of before. Okay. Pressing right along here, we got the surgical terms. So all of these are built from word parts, so I'm not going to go through them because I feel like you can put them together. But a lot of this has to do with either repairing, excising, or cutting into to kind of redo a lot of neurological construction. So just practice these words with exercise 19. You hopefully already know what all the different parts are. For example, incision into the nerve root. I don't really know why it's not down here twice, but let's see if it shows. Oh, it's because it has different combining forms. So you can call it a radicotomy or a rhizotomy. They both really mean the same thing because rhizo and radical both mean nerve root in this case. I think rhizotomy just sounds a little easier. This is going to bring us to the diagnostic terms. So there were not any surgical terms that were not built from word parts, which is good. These are the diagnostic terms that are built from word parts. We'll have a couple that are not, but these ones are. So we have cerebral, so pertaining to the cerebrum. Angiography. So again, graphy means the process of recording. So this is the actual process that you would do. And in this case, angio would be the blood vessels. So this would be really recording the blood vessels in the cerebrum. And I think accidentally I went to the slide next. That's what this looks like here. So you can kind of see with contrast imaging what that looks like. So you would have to inject the person with some contrast media and do some post-processing on the computer, but you can kind of see all those different blood vessels to help identify blockages, deficient blood flow, and see how this says angiogram. So that is the image. So graphy is the process, but the image that you get as a result would be the angiogram. Another term we have is CT myelography. So again, we're going to be recording, in this case, the spinal cord, and this is going to be done by a CT machine, computerized tomography, and often this one has contrast media as well. Looking at neurological problems, you can do an EEG, or electroencephalogram, as it's called. So this really tracks the electrical activity of the brain, trying to monitor epilepsy, for example. They use this when they do sleep studies to try to figure out what's going on, that kind of thing. Electroencephalograph would be the machine. The graph is the machine that's doing the recording, and the process is called electroencephalography. Super tricky because there's 3 suffixes, and they all mean slightly different things. So you would perform the electroencephalography procedure with an electroencephalograph to produce the picture, or an electroencephalogram. Everybody always gets them confused. Okay, so here's a picture of recording, in this case, the spinal cord. So this would be the myelography. So whether it's recording via a radiographic image or CT scan or otherwise, this would be the picture. You can see this part around here is the vertebrae, and then in the middle here is where that spinal cord is. Okay, these are the ones not from word parts, and you guys have heard these different diagnostic terms before, but you might not have known what the difference is. So a CT scan, or computerized tomography, it was formerly called a CAT scan, but it's really a series of x-rays. They take a bunch of different sectional pictures and basically compile them all together. So it's a series of x-rays through a plane, so you can kind of come up with a bunch of slices together to get a good picture of the brain or the spine or the neck. MRI is a little bit different. It uses magnets. If you've ever had to get one, you're sitting in a big donut that kind of clicks back and forth. It stands for magnetic resonance imaging because it uses magnets instead of x-rays to get the picture. But the idea is the same. The magnets kind of collect the picture. You can get a series of slices, and you can see the picture there on accident. You can get a series of pictures that can kind of give you a good, accurate representation of the brain area. And as I accidentally showed you, we'll see pictures in a minute. A PET scan is positron emission tomography. This one does use some contrast dye. It's a nuclear medicine test. It basically combines those radioactive chemicals with a CT scanner and allows you to look at blood flow and metabolism. For neurological diseases, we have an EP study, which stands for evoked potential. And this really looks at brain waves. And they do various tests. They look at how your brain responds to visual, auditory, other types of sensory tests, just to see what your brain is doing. And then we have a lumbar puncture, or LB. This is also, LP. It's also called a spinal tap, really where they insert a needle into your subarachnoid space, suck out cerebral spinal fluid, and then they can test it for different things. So take a moment, work on exercise 26, and then we can kind of proceed on from there. Here's an example of the lumbar puncture. You can see the giant needle getting stuck in. But you can see here too that the person is in a very special position. We learned that hopefully in chapter 3. But the needle is always put in the same spot for every procedure between L3 and L4, the lumbar vertebrae, just because that provides the biggest open space and you can kind of see all the different layers. It has to be really careful because you don't want to be poking the spinal cord either. And this is the cauda equina, which is kind of the nerves coming off of the bottom of the spinal cord. So when you get down to this region, it's not the full spinal cord, but really these projections that come down. All right, so here's kind of a graphical representation of what each one of those pictures can show you. The CT scan, again, this is just one slice. It looks like an X-ray, but in reality, there would be pictures of slices from above and below, so you can kind of get a good 3D image, or they would all be paneled next to each other so that you can kind of see how big a tumor is, for example, or otherwise. Here's an example of an MRI. These are better for slightly softer tissues. You can look at the spinal cord a little easier, but again, you can get a 3D image. This would be one slice within that image. You can see all the different vertebrae and intervertebral discs from the side of the person. Here's the PET scan that combines the CT scanner with radioactive tracers that then you can try to track metabolism. It gives you an idea of activity as well. The ones that are really red are the ones that are using up the most oxygen, therefore most active. Blue means that there is no activity. So you can kind of get an idea of if an area is deficient for something or what parts of the brain are lighting up or becoming active due to various stimuli. Okay, so this brings us to complementary terms. Whew, there's a ton. All of these ones are from word parts, so take a breath. Whether it's different types of pain or different types of paralysis, you should be able to put these together. I do want to point out a couple. If we remember, my mouse went crazy. Asthenia has to do with sensation. So if you lose feeling or sensation, then this would be anesthesia. You could have algia or pain in various reasons. This is the fancy word for a headache, cephalgia. So if you are, having a migraine, it can sound a little bit more important if you just tell people you have cephalgia. They'll think you have a heart disease. All of the different pertaining tos are in here. So cerebral, craniocerebral, are lumped in here too. Up here you had loss of feeling or no feeling or sensation. Dysasthenia means that you're having a painful sensation. So maybe you're having that painful tingly sensation. Sometimes if your foot falls asleep, that would be an example. Let's see. Please make sure again you remember the difference between paresis and plagia. So paresis is slight paralysis. So hemiparesis would mean that either your right or your left side of the body is experiencing partial paralysis. If you are hemiplegia, then that would mean that either the right or left side of your body is paralyzed, and usually that's a result of stroke, that you would end up with a right half or a left half that's paralyzed. Ictal means seizure, so depending on when you're talking about, interictal would mean in between seizures, so something is happening between seizure attacks. You also have pre and post-ictal if it's happening before or after the seizure attack. Let's see. Monoplegia and paresis, just so you know, mono means one, so it's going to be talking about one limb. Pan means total, so this means that it kind of seems like it would go the same as quadri. Quadri has to do with your 4 limbs, but pan would be total paralysis, so then that means you can't even really move your head or anything else like that. So there's a difference between quadriplegia and panplegia. So please take some time, work through exercise 31 before we move on to the ones that are not from word parts. All right, so just to review our different types of paralysis, When you're doing with the the right and the left, you have hemiparalysis. For 2, you can have kind of top and bottom. That's also considered really half paralysis, but we call that paraplegia. So if you're a paraplegic, then it would be waist down kind of paralysis. We don't use hemi for that. And then in number 3, that would be quadriplegia because of the 4 limbs. One's not from word parts. Some of you have had psych before, maybe are good and familiar with these terms, but afferent and efferent have to do with nerve signals being sent. So afferent would be towards the nervous system. So in this case, you're getting sensory input, you touch a hot stove, and then those signals get sent to your central nervous system. Efferent, I think of like exit, is going away from your nervous system. So these would be the messages coming back to your hand saying, pull your hand away from the hot stove. Ataxia has to do with a lack of muscle coordination. So the A part means not or lack of, but taxia really has to do with movement. So for example, if a plant grows toward the light, that's called phototaxia. In this case, you're not moving at all for ataxia, or you're not coordinated. Cognitive has to do with your mental ability in terms of memory or reason or comprehension. Coma, if someone is in a coma, then they're in a state of unconsciousness, which is another term over here. Unconsciousness means that you're unaware of your surroundings. You cannot respond to stimuli. And that's really the defining characteristic. If at some point you can no longer respond to stimuli, whether it's pressure, light, whatever, then you can go unconscious. And if you're in a coma, then you've been unconscious for a while. Concussion, I feel like most of you know what that is, but basically your brain just slammed up against your skull and can cause a little bit of trauma. Conscious, obviously the opposite of unconscious, so you are aware of your surroundings, you can respond to stimuli. Convulsion goes with seizure. A convulsion is a sudden involuntary contraction. So if you've ever seen someone in a grand mal seizure where they're on the floor shaking, that would be a convulsion. Disorientation means that the person is confused. They don't really know where they are, what time it is, or maybe they don't know who they are. Dysarthria has to do with inability to use speech well. So they're having trouble with their mouth and lip muscles. They can't really control it very well, so they're having trouble communicating or saying words appropriately. Gait, I mentioned that when I talked about Parkinson's. This has to do with how you're walking. It's really like there's a walking gait, there's a running gait, and transitioning between them. Incoherent means that you are unable to express your thoughts in a logical manner. So if someone is being incoherent, then they're saying things, but they don't make sense 100%. Paraplegia, I had mentioned this before, but this is that waist down kind of paralyzation. Seizure, we talked about already. A shunt. A shunt is a tube that gets implanted in various parts of the body, oftentimes in one of the blood vessels in the brain, but it really can go anywhere in the body. But you implant it to redirect flow of a fluid, whether it's cerebral spinal fluid or blood or otherwise. It kind of opens up vessels that might be clogged off or clotted off with a thrombus, something like that. Syncope is when you faint due to lack of blood flow. So sometimes if you stand up too quick and you can't get enough blood flow to the brain, then you pass out. That's called syncope. And we already talked about unconsciousness. So please take a moment, work on exercise 35. It's matching. Make sure you have these terms down. We're almost to the end. we are now to the behavioral terms. So all that's left in this chapter are behavioral terms and the abbreviations. Okay, so the ones from word parts are a lot of the specialties. Like I mentioned earlier, we have a psychiatrist who studies psychiatry. The psychiatrist studies the disorders of the mind, but usually they have extra training in various areas, whether it's specific behavioral disorders or mental disorders. They are medical doctors in the sense that they can prescribe medications to go with the disorder. Whereas later in the list we have a psychologist in psychology. The psychologist is a specialist of the mind. They oftentimes have graduate training, so they're PhDs instead of MDs. They cannot provide medication, but they do have kind of an extra emphasis in different types of counseling therapy. Psychogenic has to do with producing or originating in the mind. So if someone has a psychogenic disorder, it's within the mind. Psychopathy, you automatically have a connotation when you think of a psychopath, but it's a disease of the mind. It's much more general than the negative connotation. Psychosis is just an abnormal condition of the mind. So a lot of times that if this is associated with a mental disorder, we're talking about someone having a psychotic break or in psychosis. They might be having delusions, hallucinations, that kind of thing. And then lastly, psychosomatic has to do with, got a little crazy there, pertaining to both the body and the mind. So if you're having a psychosomatic condition, it might be starting off psychological, but it can produce or manifest itself in body-like responses. Okay, so this slide again tells you just the difference between a psychiatrist and a clinical psychologist. Your book talks about the same thing, but there are reasons to go see one or the other. Okay, so here are all the behavioral terms that are not built from word parts, but I feel like between health class and probably psychology, you've seen most of these before. Let's see. I'm going to let you really look through these. They're in your book on page 625 is when it starts to go through these. And really you don't have to know the exact word-for-word definition of all of them, just kind of the general gist of how each one is different from the other one. But then practice exercise 42, it's matching. It should be pretty helpful to match the disorder with what it means. Okay. As a review, PTSD stands for, hopefully, post-traumatic stress disorder. And please understand, post-traumatic stress disorder, PTSD, does not always have to do with, for example, military coming back. It could be any result of a trauma. This happens a lot with children who experience trauma. And other, people who experience something so crazy, whether it's they're in a hostage situation or whatever, if they have some kind of life-altering trauma, PTSD often can result. Okay, abbreviations. We've learned all these words in full length throughout the chapter, but a lot of them have abbreviations. I tried to highlight them as we went through a little bit, but here they all are. They're listed on page 628 if you need a little bit more of a refresher to remember. But then there's a good exercise afterward that should help you too. But that gets us to the end of the chapter. Quick review of abbreviations. Sudden deficient supply of blood to the brain. So lasting for only a short time. That's the key there. This would be a transient ischemic attack. So there's some kind of blockage, but it's only temporary, and then blood flow returns. Record of electrical activity. This would be the electroencephalogram, or EEG. You can see what it would look like under various conditions. All right, and then at the end, as always, we put some medical terms in context. So if you can practice reading these words aloud, really understanding how they relate to each other and what they mean, I think you'll be in good shape. And that brings us to the end.